So, very good afternoon to all the eminent participants who have joined us, and it is our pleasure to have you here. Today, we are here to discuss about rabies, which is operated almost 1 year in the market, and almost we have served 40,000 patients with rabies, and there are no adverse drug reactions we have noticed. Today we are having as speaker Dr. Sanjeev Kumar Bhalla. He is MBBS MD from Government Medical College, Amritsar. He has completed more than 3 decades in medical profession, a senior medical officer in SDH, and a deputy director in Punjab Health Services. He has significant role in handling various epidemic diseases and also a good social worker. Right now, he is currently working as a medical director in US Medicity Hospital. So, doctor, today we are going to discuss with you all regarding the novel three-dose G protein vaccine. And with this, Dr. Bhalla, it's over to you. We can start the session.
Hello, good afternoon, everyone. I just want to have a medical knowledge with all my dear friends about the rabies and about the novel three-dose G protein vaccine, which is introduced by Cadra Pharma as a therapist. Rabies is almost 2,500 years old disease. History is there when around 4th BC, the sign and symptom of this disease were noticed at some places. Rabies virus belongs to Lyssa virus of the family Rhabdomyridae. This disease is basically caused by the bite of mammals, and that makes it more serious as mammal gives a bite to the human and it ends in a fatal death. And this, you can just see that globally around 59,000 human deaths occur annually, and in India only 20,000 human deaths occur per year. According to this, 60% of the rabies death in the Asia and 35% globally. And in India, 91% death occurs in the rural area. Next slide, please. And every 9 minutes, a person dies from rabies. So what is the current management? Current management at the present scenario is the local wound treatment given as a first aid, and then active immunization with the vaccines and passive immunization with the immunoglobulins. Next, the problem with the previous vaccine and previous treatment is that patient is basically a non-compliance with the previous prophylaxis PrEP treatments. Current vaccines which are going on are cell culture vaccines, and the older vaccines are more than 50 years old, so there is inconsistency in potency, inconsistency in stability, availability was very poor, and there were not many adverse events. Next. And now what is compliance? Compliance is one person who receives the full course of ARV, that is, he takes an anti-rabies vaccine on the recommended dates as described by WHO. Delayed compliance, the person who takes the ARV within 60 days but deviates from the scheduled regime. And dropouts or non-compliant are those who take 1 dose of ARV after animal bite but does not complete all the scheduled doses. Next, please. Rabies post A retrospective analysis done at Kerala Clinic is that majority of the people who received rabies vaccine, they took at a very irregular manner and most of them were late. Late in the initiation of PEP, administration of human rabies virus was done at irregular levels and antibody levels of these were 0.5 IU/ml in 6 of the 90 patients, that 6.7% people did not get a proper dose after 4 doses of vaccine. And conclusion is that patients don't always receive optimal rabies prep under real life conditions. A significant proportion of the patient didn't develop adequate antibody level after 4 doses of vaccine. Next, please. So non-compliance to 5 dose was a proven cause of death. There are few incidents where the cases were studied where 3 doses of cell-cultured embryo cell vaccine were given and ultimately patient either died or got lama with sign and symptom of all the clinical and pathophysiological functions of CSF findings as well as MRI findings suggesting of encephalitic type of rabies. The reason of death may be due to lack of administration of rabies immunoglobulin or poor compliance with the vaccination. Next, please. So, compliance to the post-exposure prophylaxis among animal bite patients. A study was done at the Safdarjung Hospital where it was found that 53% of the patients were non-compliant to the full course of ARV, a very high number. Next, please. At Municipal Corporation Hospital, Bangalore, where about 215 animal bite patients were given rabies vaccine intramuscularly on 0, 3, 7, 14, 28th day as a PEP, it was found that if there was 100% on the day 0, it was day 3, 88%, day 7, 85%, day 14, it was 70%, and day 28, it was 6%, indicating that compliance rate for intramuscular rabies vaccine was about 60%. Next, please. What are the constraints? What are the constraints? Why the people don't comply to this complete course of anti-rabies? Reason being, 11% people were, the vaccination time was in the school timings. 11% told that patient hospital is far away. 13% has a cost problem. 18% has a forgotten dates, and 47% people told that they lost wages whenever they go to have this anti-rabies vaccine. A major constraint for compliance to complete ARV laws was major loss of wages, which was about 47%. Next, please. Then with this, the evolution of rabies vaccine started. In the year 1885, a non-standardized dried preparation was used where up to 31 injections of this live attenuated vaccine from the spinal cord was given with increasing immunogenicity. Then in 1911, inactivated vaccine from brain up to 10%, minimal neutralizing content in liquid preparation, 14 injections used to be given 0.5 ml daily for 14 days. In 1976, cell culture vaccination started with 2.5 IU and 5 injections were given on 0, 3rd, 7, 14 and 28th. Next, please. So non-compliance led to the evolution of treatment from 31 doses to 5 doses, and still the process is going on. So meeting the unmet medical need, introducing a novel vaccine with the simple and shorter regime. Next, a novel vaccine with a 3-dose recombinant rabies G protein was introduced. This is the first protein subunit and it is prepared by VLP platform technology, with first vaccine having no genome, better compliance, convenience, and ready to use, and no reconstitution required, and it is having a very high antigenicity and a good development of antibodies. Next, please. And now, what is VLP technology? VLP technology is one, in a normal virus, there is a genome inside and there are other proteins, surface proteins, matrix proteins, G proteins, etc. around it. And Cadila Pharmaceutical Limited has developed a process in which this VLP is virus-like particle which is having a structural similarity with the native virus but without a genome. And this leads to genome minus virus and with very good immunogenicity for the development of antibodies against this rabies virus. Next, please. So clinical phase were done in different situations where studies were designed with 0.3 2 doses and 0.37 3 doses, and results were almost similar with the WHO sponsored seroprotection data with this G protein, novel G protein vaccination. Next, please. And clinical study phase 3, which has shown that rabies G protein vaccine administered at stimulated post-exposure immunization, a randomized comparator controlled multicenter phase 3 clinical study showed that, next please, it is showed that this vaccination is same, having a same efficacy, and it is not inferior to the normal WHO sponsored 303.7.14.28 regime as per the reference, and the rabies having 0.37 days regime schedule. 553 subjects were done with the rabies and 267 subjects were done with the rapid vaccine. Next, please. So result is that results were very consistent as far as antibodies development are concerned. Seroprotection, primary endpoint results on day 14 and 42 were met. Test and comparison are identical in seroprotection rate, both in days 14 and 42. So, and there are very few local side effects like local adverse events. Localized pain was 7.69 as compared to 13.56. It was redness was less, swelling was much less, and other symptoms like fever, ear pain, headache, joint pain, and nausea was very less as compared to the other vaccines than novel G3 vaccine. Next, please. So, conclusion is that novel 3-dose was not inferior to reference vaccine. It was having less side effects as compared to the reference vaccine, and novel 3-dose was found to be safe, immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. Next, please. And with this, Golden Globe Tiger Awards given by Malaysia for Innovative Product of the Year and Pharma Innovation of the Year by the Economic Times. Thank you so much.
Thank you so much, sir, for giving this valuable lecture and your experience on rabies. Sir, there will be few questions which I will read so that you can address to the participant. Right now, we are almost having almost 80 plus participants with us who are listening to you, and they are patiently waiting. There are a few questions which I will be asking from you. Sir, first very common question which is asked by many of the doctors as well as the uh, people who are going to pass out from the final year of uh, their medical education. First thing is, what are the symptoms of rabies?
Rabies, there is sometimes there is no history of insect bite, the mammal bite, but mostly there is history of a mammal bite, mostly by a dog or followed by a monkey or any other like jackal, horse, etc. Then patient is having two types of symptoms. One is encephalitic symptoms, another are dumb symptoms. Patient, most important symptom is patient is furious and he gets very fearful. And there is hyperstimulation of his nervous system and is having aerophobia, hydrophobia, difficulty in swelling, and all these problems, and ultimately patient loses his consciousness, goes in coma, and then dies.
Sir, second question is there. Suppose a patient has to take 5 doses of vaccine, but he or she has taken only 3 doses. So is it possible that they can get rabies symptom after 3 months or 6 months because they have not completed the 5 dose course?
Yes, it has been seen that if some traditional vaccines are taken incomplete or they are not compliant to this, sometimes immunogenic level is not high to prevent the disease, and patients do get rabies disease.
Okay, sir. And sir, one more question is there that where is the most common cause of rabies? Like which dog bite or cat bite or monkey bite? Where you get most of the patient for rabies?
It is the dog bite. 99% it is the dog bite which causes most of the problem. Second, followed by monkey.
Okay. And the severity of the symptoms and everything is the same, or is there any difference, like within a dog bite or a monkey bite?
Symptoms are not any difference. Once a disease occurs, then it follows all the neurological pathways, and disease occurs in the same way. Ultimately, in the majority of the cases, when a person gets rabid or it gets rabies properly flared up, it is almost death.
Okay, sir. Shivam, can you check if any questions are there? You can also ask the doctor to address.
No, ma'am. Thank you. Done.
Okay, sir. So, sir, most of the question has been already addressed by you. Sir, any of your experience in your life because when we are conducting these webinars, we are conducting all over India. Almost 100 plus doctors we have taken as a speaker, and they have shared their own experience of rabies. And few of them, they have rabies victims in their own family also, where 5 doses was not, because rabies, what we have seen that people are not that much of aware, especially in rural areas. So in your experience, you have seen any baby patient the course has gone very like fatal, like patient has expired also. Like, please share your experience of rabies so that the other participants who are there with us they can listen to it.
Yes, people sometimes take only 1 or 2 doses and then they watch the dog has died or not. They will look after, as it used to be said that if the dog lives for 10 days, then there is no rabies. People used to think like that. They used to take 2 doses and they usually stop the next dose. But I have seen at least 1 or 2 persons who had rabies after 30 years of their life. 30 years, there was no history, and it was history that 30 years back he had got a dog bite. And it was very hereditary. We got history from the mother who told that his son got a dog bite from about 30 years back and he got rabies and ultimately he died. Every effort was put to save him, but he couldn't be saved. So in my opinion, I will request everybody to take vaccine full dose, compliant to the dose, as death rate in this case is almost 100%. Hardly under Indian conditions we can save a person, and if we can save a person with this prophylaxis dose, it is highly desirable and we should go for it at any cost.
Right, sir. And also, especially for children, because children they used to play around the dogs, street dogs. They are the major reason which are responsible for dog bites. And children, what they used to play with them. And if we see 28 for the period of 20 days for 5 doses of vaccine, we have to go to the same hospital. So they resist a lot for injections. So for that kind of patients also, it is very safe. And sir, thank you so much for being here and giving your valuable talk. Also to all the eminent participants who have joined us and have patiently listened to the entire webinar. Also for the valuable questions they have asked. And thank you, sir, for being part of this journey. As well, we are also working on Rabies Mukt Bharat by 2030, which has been taken by APCRI also. So we are also working on that. We are also creating awareness regarding rabies through our posters, especially in the rural areas. And we are also conducting these webinars almost every month so that people can also get educated regarding rabies and what are the symptoms and why it is important to take vaccine and the compliance, how it is important. So thank you so much, sir, for being part of it. And Shivam, sir, please kindly continue if anything else is there to add.
Thank you, sir. Thank you so much for giving your precious time to us, sir.
Welcome.
Have a good day, sir. Thank you.
Thank you so much. Thank you, Sanjeev, sir. Thank you so much.